our fourth presenter now, Dr. Sophia Nimphius from Edith Cowan University. Her title is the muscle of men and women really that different? When you're ready.
Now with this question that you have here, many of you in the audience may have already answered it yourself mentally by going, why of course? And then some of you may have said, well of course not. And then some of you said, well that's the purpose of you being there, to tell me what the answer is. If you don't know the answer to that question, many of us in the room would automatically research that, maybe searching a database. And if you use the search terms sex and injury or sex and performance relative to athletic performance and or even something like hip fractures in the elderly, you'll get research articles that actually look a little bit like these two titles. And in these two titles, you'll see something pointed out right away. And there's actually hundreds of articles like this, not just these two. And you'll notice that there's one term, muscle activity or muscle activation, that comes up very, very regularly in the research. Muscle activity is kind of what gives us our coordination for movement. It's how much we turn our muscles on, the order we turn them on, as well as how much we turn them on. Now, when we're talking about that, what I'm interested in is, does that muscle activation really differ between men and women, or is there something else that's going on? Now, there's four major factors that differ between the sexes that are often talked about in those types of research articles. Of course, muscle activation is one of them, how we use our muscles to coordinate our movements. Then there's two others that I have listed here that are pretty non-modifiable, so we're stuck to them because of the sex that we are. One is ligament laxity or joint laxity. As you can imagine, if you were running and you want to change direction rapidly, you'd want your knee joint to stay there so that you don't have that dreaded injury of an ACL tear. In Melbourne, you'd probably know what that is, being AFL mad. The other thing is joint structure. But the good thing about joint structure differences between men and women is we've found it's probably not that related to injury. Then there's the fourth factor I haven't talked about, that elephant in the room, so to speak. Strength. Most of us here would agree that most men are stronger than most women. We just chalk that up as normal. But the fact is that men and women adapt at the exact same rate to a resistance training program. Their relative strength differences change similarly. I need to be as strong as I need to be to control me, my body weight. Men tend to be heavier and have to be overall stronger, but relatively just strong enough to control their body. I hope that makes logical sense, because to me it made absolute sense. But what I can tell you is that in all of those hundreds of research articles, never have they actually compared strength-matched men and women to see if it was strength that was modifying our ability to activate our muscles, or if it was actually sex differences. And that seems to be a huge oversight in the research. Because strength is 100% modifiable. But if we're intimately linking it with the muscle activation, then how do we know? Was it really that men and women differ in muscle activation? Or is that on a random sample, most of the men were stronger than most of the women, and it could have actually just been their strength differences? So we sought to answer that specific question. We got 16 pairs of strength-matched men and women based on an overall muscle strength test. When we matched them, and we looked at how they activated their muscles during different activities, we found this. Nothing. Not that we found out nothing at all, but that we found absolutely no differences between the men and women. That has huge implications for those hundreds of articles. We now have to question whether without control for the strength between the men and women, was there really a difference in their activation strategies, or was it just the strength differences that determined whether we activated those muscles in an appropriate way to perform the activity? That doesn't have just implications for injury research related to sport, but it actually has a lot of implications for lots of different types of research that investigate gender or sex differences. For instance, prevalence of falling, your ability to control your body while you're walking, and whether you fall and fracture a hip, as we often look at with men and women that are elderly. There's a higher prevalence of injury in women than there is men, not just at the athletic level when we're young, but it carries on all the way to when we are older. So since we can modify strength, finding that it washed out those sex differences is critical so that we can make everyone strong, because strength is an equal opportunity employer.